So in my line of work as a chiropractor, working with a lot of sports-oriented folks, what we've come to find is there's a lot of issues with the feet that can affect how somebody squats, how they're moving, their gait, and a lot of lower back and hip issues can actually be traced down to the foot. A lot of times people will go to podiatrists or put inserts in or even get surgery on their feet for problems that they can possibly manage with just a few mobility tricks that I've developed and come across over my time as a professional. So today what I want to do is go over a multi-point corrective technique that you can approach to the feet that seems to have some pretty good effects with most people. So this is in no way here to diagnose any problem you may have or to treat one single issue. This is a way to sort of globally correct a lot of problems that I see in the feet that will make them more functional and possibly lessen your pain and make your feet perform better in everyday life. So we're going to go point by point. So first of all, let's talk about what happens to the feet, okay? It's in my opinion professionally that when a foot is not moving properly, there's two things going on with it. One, there's an issue with flexion extension, okay? Now, we have this bone at the top of the foot called the talus. Now, the talus is what basically helps our foot go up and down, okay? Then we have an issue with people rotating their foot in or inverting their foot with a common ankle sprain, which we've all had as kids and adults as well. So, what we tend to find is the foot can get consistently stuck in two positions. One is forward flexion, or we call it plantar flexion. That's where the foot is basically stuck kind of like this forward instead of in this nice orientation here. We can make an argument that maybe elevated heels in shoes, like high heels or even tennis shoes, can cause that, but that's all theoretical, and we're not really going to do that in today's video. But here's what I want you to assume. Anytime you're wearing shoes, you are cramping the feet, you're compressing them, and that can create some limitations to how well the foot can function. So I'm not going to tell you guys all to take your shoes off, but be barefoot as much as possible is usually a generally good idea. That being said, as I've said before, the two things that usually happen with the foot are it gets stuck in this position, and it also gets stuck in this position. So we're going to fix those two positions before we even worry about the tissues of the feet like the plantar fascia or the Achilles. So, first, the bone in the very, very base of the, or the very top of the ankle is called the talus. And the talus bone tends to sort of shift forward and it gets stuck in a forward position. That's what we theorize is blocking the ability for the foot to come up like this. So you have to wonder, is the reason why your Achilles or your foot cramped up because those muscles are just tight? Or is it because that bone is shifted forward, sticking the foot in this position and causing these muscles to cramp over time? We're going to go with that theory, and we're going to try to fix it right away. So here's the technique that I like you all to try at home to see if you maybe walk or have a little bit better gait. So what we have here is a workout bench, all right? And we're going to use this as a way to sort of help shove this bone back in a better position and get better dorsiflexion. Not everybody's got access to a workout bench, so you can use a table, a chair. I recommend something that's firm that you're also able to maybe put a towel over to soften up, because this is a very sensitive area. In fact, this whole technique will cause some discomfort, so I want you to be very careful when you apply it and to ease into it and see after you do a few repetitions if you're actually getting any change. So what I'm getting at is do the technique, walk around, even if it's painful, if you feel like you walk better with a little bit more ease, that's kind of what we're going for. So here's what you're going to do. You're going to take your foot, your hand, or you're going to take your leg. You're going to put it on the side of a table or something like this or in a chair and sit like so. You're going to take your other hand and you're going to find your heel or your Achilles, and you're going to drive downward like so, okay? Just like this, over and over again, okay? What you're trying to accomplish is you're trying to push your foot downward while this blocks the top of the foot, pushing up into it. I can't stress enough, this is going to feel very uncomfortable because you're literally pushing the foot forward while trying to drive something back into it here. So the foot's going to travel like this. After you do this, walk around. I bet your foot will feel lighter when you're taking steps than it did before. If it's more painful, discontinue what you're doing and talk to your doctor, because this may not be the best technique for you. But this is what I tell my clients to do first and foremost, because we got to get the foot in a good position to move right to begin with. So just one more time, and I'll show you on the other foot. You basically would come up to a bench of some kind, put a little bit of pressure right here, and then drive downward like so, over and over and over again. Okay? The second corrective movement we're going to do is to try to take care of this inversion that we've gotten stuck in by trying to force a little bit of what we call eversion. That's the ankle coming this way. So I call this the inversion correction. There's a lot of options here. I'm going to push something we sell. This is an alpha ball made by Tune Up Fitness. I find that these work really well for what we're going to do in this next part. But essentially what you're going to do is you're going to take a ball. It can be a tennis ball, but I like these alpha balls. Put it right here on sort of the aspect of the ankle right on this area. So you're going to go right about here, okay? And you're going to, hope you don't see my dirty feet here. So what you're going to do is you're going to put the foot in this position. You're going to crank it back a little bit. And you may have to get a partner to help you with this if you lack flexibility. And you're going to push down onto that ankle over and over and over again, okay? Basically what we're trying to do is just force a little eversion into the foot. So I got a little bit of flexibility and this is still pretty rough on me, but what you can do is get a partner to just have your foot there and just have them apply pressure downward. That's going to help your foot do more of one of these so you can get that better movement. Again, the whole point of both these first two moves is to get better function of the foot before we even do any soft tissue work. Because if you don't have good movement, it's hard to get those tissues to do what they need to do. Okay, now that we've taken care of the movements, what we're going to do next is we're going to work on the Achilles area and the plantar fascia. Now, I should mention that I do recommend foam rolling, but we're not going to go over that today because I'm sure most people know how to foam roll. So I'm going to get into some specific stuff rather than do that. So what we're going to do, there's a point in the calf where this smaller muscle called the soleus meets with this gastrocnemius up here. And you can see it whenever you have that little indentation in the calf right there. That's what we're going for. We're going to take this lacrosse ball and we're going to put it about that midpoint. Okay? Now it's going to be a pretty tender spot. It's a trigger point, so don't be applying a lot of pressure right away until you're comfortable with it. But if you feel okay over time, you can cross the leg over. Again, don't look at my dirty feet. So what you're going to do is you're going to rotate and move the foot around, okay, while pressing on that spot. The idea is that when we put a ball in this area, we're going to restrict movement down here, and we're going to fight to get every bit of movement we're trying to get in the foot here. So you want to put that ball there and move it around in different circles, in different positions, up and back, side to side, forward and back. When you remove the ball, you'll notice, hey, that foot feels a lot easier to rotate and move because we've worked out some of the restrictions in this part of the muscle. And a lot of times this is bound up, creating problems in the Achilles way down here. Another option, though, if you have a dumbbell at home, especially one of these hexagon ones that's not going to roll, you can just drape your leg over that, and I find that works really well because you can also sort of rotate and cross-friction it a little bit. But then you can work it the same exact way. Again, I recommend crossing a leg or something over it to kind of weigh it down. And you're going to work on bringing the foot back and forward, side to side, big circles. You're just basically trying to create pressure in this area and rotation and movement here. For this next part, we're going to talk about the big elephant in the room, and that's what most people have a problem with, and that's plantar fasciitis, or the plantar fascia. This is the connective tissue on the bottom of the foot, okay? And what tends to happen, again, I'm not going to get into the theories about why the plantar fascia is so problematic, but in my experience, I find a lot of people are trying stretching techniques and bracing techniques when they're not actually really getting any movement back to the bottom of the foot. So here's what I prefer to work on. We want to take a lacrosse ball or any firm ball or firm object you may have. You're going to put it on the ground. And we're going to attempt to step on the ball. Okay? Now, I'm going to be very nuanced here and talk about one of my biggest complaints about whenever I have people work on this. what I tend to see people do is they will dance out here in front of the ball, rolling the ball around, and that's all well and good, but if they would just shift their weight forward and keep their weight on their heels and sort of just lift their hip up on one side and apply pressure downward while supporting themselves, they're getting a lot more direct pressure down on that spot. And now we can kind of move the foot in smaller movements and really find out where it's nasty and built up. So, in a lot of therapy, I see people doing this, but missing a major component that I find really helps get function back to the foot. And that's one very simple thing, if you want to focus back down here. So right now I've got this ball compressed on the bottom of my foot in a really painful spot. I'm going to do one thing that everybody misses. I'm going to engage my toes by pulling them up and crunching them down. And I'm going to do this a few times while that ball is compressing on that one spot. And I'm maintaining good stability. Back and forth just like that, okay? Now I'm going to pause, keep the foot relaxed. I'm going to roll a little bit side to side, find another tender spot, compress it with about as much force as I feel is appropriate, and then again, back, up, and down again, okay? Back, up, and down. You're going to relax the foot again. We're going to roll through it again, finding another spot, same thing. So basically what I want you to do is I want you to work on the entire bottom of the foot for like 3 or 4 minutes. You can go longer if you want, but don't rush into this too quickly. But basically try to find any spot on the bottom of the foot that feels painful and tender, and you're going to work through crunching and extending those toes while stepping on that ball. You want to let the ball kind of dig in gently to the tissue before you engage it, but the point is that this is going to get you a lot more progress and function back to those toes while also stretching the plantar fascia. Again, what I tend to see a problem with is everybody wants to stretch the plantar fascia, but they don't actually want to work the intricate toe muscles that are actually usually atrophied or weak that are probably causing the plantar fascia to be tight to begin with. So you're killing two birds with one stone. You're stretching it out while working those muscles that are weak. I find much better results, and you'll probably find after about 5 minutes of work on one foot that you can walk around and that foot will feel lighter, more functional, and more just in tune with the ground than it was before. Make sure you do this on both feet always. So for this last part, we're going to talk about something that's probably it might be the most important thing with the foot in regards to retaining function back to it. But it gets overlooked a lot. So we're going to talk about abduction and adduction of the toes. And what that is essentially the ability to spread and compress the toes. Now, or basically do this with the toes, if you need a better visual. So, again, I'm not going to get into theories, but you have to think, if you're wearing shoes all day, even if they don't feel like they're that restrictive, they're going to compress everything together down here. And that's going to create this tension pattern, and more importantly, it's going to prevent the foot from actually getting good abduction and adduction of the toes. We can make the argument that lack of movement might be the cause upstream for where a lot of things we see problematic with the foot happen. So my point is if we can get abduction and adduction back, it's a pretty good idea. So there's a couple techniques, and I'm going to go over the easiest one that doesn't involve any equipment first, and then I'm going to recommend some equipment to you to work on as well. So here's what we're going to do. It's very simple. You're going to take your foot and cross it over your other leg. And this is where it gets a little gross. I know there's people out there that hate working with feet. Get over it and work on it, and your life will be a little bit better. So get over your fear. Take your fingers. You're going to weave them between each of the toes right here, just like so. And again, if you can see there, I have shoved my fingers in pretty deep. Okay, it's not very comfortable for my foot right now. So what you're going to do then is this. I've got this barrier, as in my fingers, between each toe right now. I'm going to compress my toes against, like I'm doing this, against my fingers, and then I'm going to pull away. I'm going to press against and pull away. Now you're going to get cramping in your foot. Like I got significant cramping right now in my arch. That's fine. You're working muscle tissues. But what you want to do next is you want to rotate the foot through all ranges of motion circularly and find out where it's tight, and then crunch and pull away. Crunch, pull away. Now you want to continue working on this for a few moments. You can even
rotate the foot here, like I'm sort of doing. I'm isolating this part of the foot and rotating here, crunch and pull away, crunch and pull away, crunch, pull away, crunch, pull away. And you just want to keep on working through this for maybe like a minute or two, crunch, pull away, and so forth. The idea though is, once you get your fingers out of there, and wash your hands of course, be clean, you'll find that your foot has a lot better ability to spread the toes and compress them than they did before. And if you happen to be a lifter, I really recommend doing this if you're going to be doing a lot of squatting, because it'll help you grab the ground a little bit better and get a little bit more control with your foot. Now, if you want to be a little smarter, and if you don't feel like getting your fingers dirty with your toes, what I have here is what's called a toe spacer. I picked one of these up online. They can be a little pricey, but they can also be pretty cheap too. But the idea behind this is you're going to put your toes inside of these. This is the same kind of object they use at to get pedicures and things like that. So I'd even recommend patients use pedicure style toe spacers. But basically what you do is you take one of these and you shove it between all the toes, get it right in there, really deep, compress and pull apart, make sure you're in there, and then you can just walk around your house for a bit, like 30 minutes, is just spacing those toes. However, the key here is not just to stretch out the toes. As I told you before, you're pressing and pulling away from there. So you're actually using that toe spacer or your hand, whatever you're using to space your toes, as a barrier to press and pull away from. That's going to reactivate the neurology in the foot and help get some of that activity back. So it's not that you're just strengthening the feet, you're actually getting your brain to activate movements that it's forgotten how to do because hypothetically you've shoved your feet into shoes all day. So it needs to get woken back up, it needs to be activated.